So, just now. It's enough to just provide information. Our information is good. We have to recognize that informing is not miscommunication, and informing that is not enough in many cases. Are the patients satisfied? I've just heard now there is a lot of problem with the communication with the patients, and probably no. And what happens if a patient is not satisfied? Well, happens that the patients go to other platform, looks for information about other patients, and look there. With the procedure, it's painful, or peritoneal dialysis versus regular dialysis. This is shown that the patient has some problem of communication in their staff. And so the patient go to platform with patient which has the same problem. For example, this one patient like me, but there are a lot of sites about kidney disease. But one of the most important questions is about nutrition. Nutrition is the key problem for most of the patients. There are again a lot of sites with the diet on the renal nutrition, but we know that the kidney patients are continuing in a dark room about nutrition. You have just seen here that it's very important to have some site with good nutrition. So what we have to do? We have to change our habits. We have new skill. We have necessity to have knowledge. But overall, we have to new skill about effective communication. Effective communication to do what? Supporting patient to make the best decision, no decision about me without me. And we know that a good communication is able to influence not only choice of dialysis but clinical outcome, renal therapy, therapy for hypertension, for example, therapy for nutrition. Nutrition is a very important problem that has to explain very well. So the Salzburg statement about shared decision making, there are some options very important. Provide accurate information about options and uncertainties, benefits and harms of treatment, and permit to the patient and the family to have just enough time for take a good decision. But what are the barriers? The barriers are essentially the doctor don't speak very well. The patient don't understand what doctor say, and so we have to be very clear when we talk with the patient. It is absolutely necessary. If we are not clear with the patient, we have a problem like this. Could you send the clip?
My asthma. They said they'd fix it, but it didn't make any difference at all.
Well, sometimes doctors make mistakes, and you need to try twice as hard to fix them. Are you using your inhaler?
All the time. Go through one a week.
You sure you're using it right?
Do I look like an idiot?
No. Why don't you show me how your inhaler works?
Well, this is one of the problems. Perhaps not the same for every of our experience, but I think it happens very often that the patient doesn't understand. He takes 2 pills instead of 1, and so on. But we know that the second barrier is the time. We have just here this morning. We have no time. We have no time, not only for persuading patients for dialysis, but for therapy, for nutrition, and so on. So how communicate? First of all, we have to talk to the patient in the language the patient can understand. This is absolutely important. That the health literacy, you have said here before, is absolutely important. We have to choose the right language with the patient we have near us. And this is a very dramatic example, because there are a lot of people that explain that the patient opinion differs from the oncologist about the survival, because the patient is understanding a different way, and the communication is absolutely lacking. We have to recognize that we read not with eyes, but we read with brain. I think everyone can read this message, but we don't read the name of the other, probably because we don't know exactly we understand only if we know, and the patient doesn't know everything during his experience. So this is a very important example by Taylor and Sunstein. Taylor have the Nobel Prize in Economics, and it's possible to nudge the patient with example, with some experience, and for example, which photo would you choose to illustrate dialysis to patient? I think there is no doubt everyone chose the right one, because there is a very elegant young woman wearing sneakers, lipstick, reading fashion magazine. So if we want to choose, absolutely we chose the right one. But we know that repetition helps. The repetition is very important for everyone. For example, the spread of immediate memory imposes several limitations on the amount of information that we are able to receive. Process and remember. Repetition helps bypass the limitation. And you see in the school in Japan how repeat the information. And so, thank you to modern technology, we can use social media. Social media is a match term used in PubMed. It means that very useful for clinical and health purpose, and it was very used during the COVID storm for health messaging. And we know that the physician-patient communication online exhibit a positive impact on patient compliance. So we have a lot of sites. We have just seen. I will not show because for problem of time, but we know that there is a lot of sites. We have seen now a lot from Cantanzarek, which is the site or about, for example, itching. About we have seen just now the eating during dialysis. In Italy, we have Fondazione Italiana del Rene that has a lot of advice about cooking, about fistulas, about mood of life, and so on. For example, one of the most important advice is collecting urine over 24 hours, or to reduce the salt intake. The problem with the smoke and kidney, and some recipes for two typical Italian food, lasagna and tomato bruschetta. Other social media are video, but video have some more problem. A large amount of video are absolutely fake in internet. We have to choose the right one. The principal effect of health people, the doctor, is to encourage, to suggest the right research to the patient. It's not possible leave the patient to go to find a video or clip in the internet. For example, this is only four, but there's a lot of them. There is a danger of hypoproteic diet as a good hyperproteic diet. Now, the last row in healthy subject can be affected by reduced dietary protein appears to have no foundation. So the doctor must suggest the right, absolutely the right research. And so we have once again a lot of sites. We have just seen for the World Kidney Day. I'm proud to show Italian experience. Fondazione Italiana del Rene, there are a lot of video. In this video, for example, one of the most research, the vascular access. What is vascular access? And you see it's about 30,000 contacts to explain how this vascular access is. We have Italian Society of Nephrology. For example, Italian Society of Nephrology has a playlist for nutrition and metabolism. There are a lot of videos we just see now about Dr. Canotazadek. It is very important to choose the exact results. But artificial intelligence makes it possible to overcome language barrier. It's possible to drop a file to transcribe, or it's possible to have a text to speech in language we want. And absolutely a few days ago, Google has shown that with Google Meet will be possible online to have the translation with the language with, for example, a patient who doctor who speaks Arab and translate immediately online in Italian. For example, this is a podcast. There is a social media was shown. It was possible to go to Notebook LM. It's possible to transcribe on the left absolutely all the speech, but you can ask, for example, get a summary in Italian or every other language. It's completely free. It's from Google. The last one aspect is the monitor the patient. It's possible, of course, to have the patient journey, but it's difficult because we see the patient journey only when the patient came in the clinic. So, and now it's possible with a lot of tools, for example, weight scale, device to measure blood pressure, for example, a smartphone with the possible to have the weight to collect heart rate, walking distance, that go. Every information goes to the smartphone. The smartphone is possible to send with Excel or CSV file to a doctor in his clinic. Apple Watch is able to detect atrial fibrillation. It's very useful to monitor heart rate. And there are a lot of devices, for example, for diabetes. It's possible to have the medium of blood glucose or hemoglobin. And the last one is useful to use some app. The app are useful because not only help the patient to have the right decision, but it's possible to know the compliance. Because if you miss to have the weight in this for 2, 3, 4 days, the recording is missing. So you have effectively know that the patient has everyday heart rate, everyday blood pressure, everyday weight. And in Italy we have this app, my fear ha a lot of function inside, quindi not all kidney function, but it's possible, it's very strong about the nutrition and the meal, food diary, receipt. And the concept is completely reversed, because no longer a diet prescribed by an outsider, but rather on self-control. You insert what did you food, what did you eat, and this have the result every day. For example, this is a result in Excel to send it to the doctor. We have the breakfast, lunch, and dinner. We have a protein, calorie, phosphorus, sodium, and potassium. What's the future? The future is artificial intelligence. We could use artificial intelligence for diagnosis. If you put your laboratory data in ChatGPT, it's possible. I use every day. As it extracts the data, extract the creatinine, select the date of birth. It's possible to have the clearance with very formulas and so on. And for example, ChatGPT is able to have a daily menu. Of course, it's possible only if you have no renal dietitian with you. But the renal dietitian are missing in a lot of places, in Italy too. And so, for example, you can show a 7-day menu from drawn by ChatGPT. Well, in conclusion, channel may change, language may evolve from pen to pixel, but our commitment to providing timely, accurate, and verified information remain the same, also with social media. Well, thank you for your attention.